First of all, I'd like to say that Dr. Fine's answer is going to blow me out of the water. Thank you. Thankfully, these seats are empty and I have plenty of room to breathe. So, as a beneficiary of the VA healthcare system, I'm blessed, but I have access to service through virtue of my service. Not everybody is as fortunate as that. So, things like negotiating drug prices would be a great start, but that's a federal issue. Honestly, best practices, sharing best practices with the VA, and I think they're a flagship as far as mental health services for veterans. I think they could do a great service to the community. Also, Butler, obviously, as our flagship mental health care facility, we should be expanding the amount of healthcare beds, mental health beds for people, because mental health is a serious concern. I think we should be spending more money on social, psychological resources in schools. I think that would be a great start to increasing our outcomes, especially among our student populations. So.
Very good. We'll go to Mr. Safford, 1 minute.
All right. Get to go before Dr. Fine. Well, I have to direct this question back towards the economy. We have around 90 to 100,000 temporary employees at any given time in a year in Rhode Island. And what happens with those temporary employees is it's often the burden of healthcare is often passed on to the agency that appoints them, and it never gets fulfilled. I worked in this field for a brief period of time. It's not positive, and the burden falls back on our economy and back on the state. At any given time, less than 10% of those people working those temp jobs have health coverage, and that burden then falls back on the state, and in some cases, in most cases, it falls back on the federal government. I mean, it has to be something that's done. If we're going to have universal health care, I think it's a mistake to have it start state by state, especially in Rhode Island. Our state already has an overburdened budget with no county governments, one of 2 states in the whole country. So what happens when you have no county government is things get centralized or decentralized and then overburden that state budget. I just don't see that it's really possible to happen in a state like Rhode Island.
Thank you. Dr. Fine, 1 minute.
So the good news is I only have a minute for this. But briefly, we do have problems with what it costs. And that's because we have a market and not a system. If we provide primary care to all Rhode Islanders, if we build one neighborhood health station for everybody else in the state, not just people in Situate, we'll save 30% and massively improve public health outcomes. James, I'm going to disagree with you a little bit. I think we should start in Rhode Island. We have a unique opportunity to do what nobody else has done. We've had something called the Rhode Island Universal Vaccine Purchase Program. It's been in place for the last 20 or 30 years. We supply vaccine to every single Rhode Islander. We save 15% by doing it, and we are the best vaccinated state in the nation. We can do that for healthcare in general. It's affordable. We'll drop the cost 30%, and we'll have that money left over to spend on education and housing, because there just is no more money that's coming from any place else.